How does synthetic mesh work in bladder sling surgery? Have you ever wondered how synthetic mesh works in bladder sling surgery? This procedure is designed to help those experiencing stress urinary incontinence, a condition that leads to involuntary urine leakage during activities that increase pressure in the abdomen, like coughing or exercising. Synthetic mesh acts as a supportive tape or sling placed under the urethra, which is the tube that carries urine from the bladder out of the body. The synthetic mesh is typically made from a material called monofilament type 1 polypropylene. It serves to replace or reinforce the fibromuscular tissue that normally supports the mid-portion of the urethra. When there is an increase in abdominal pressure, the mesh compresses the urethra. This compression helps keep the urethra closed, preventing urine leakage. Essentially, the mesh provides mechanical support that stabilizes the urethra in its proper position during physical activities. The procedure to insert the synthetic mesh is minimally invasive. Surgeons can use two main approaches: the retropubic approach, where the mesh is passed behind the pubic bone, or the transobturator approach, which goes through the groin. Both methods aim to position the mesh accurately under the urethra without putting too much tension on it. This careful placement is crucial for effective support and to minimize complications. From a bladder health perspective, the goal of using a synthetic mesh sling is to improve the quality of life for those suffering from involuntary leakage. This condition can lead to skin irritation, urinary infections, and social discomfort. However, it is important to note that there are some risks associated with synthetic mesh. These can include mesh exposure, where the mesh erodes into surrounding tissues, urinary retention, pain, or infection. While these complications are relatively uncommon, they are important to discuss with a healthcare professional. It is also essential to understand that synthetic mesh slings are not used to treat bladder cancer. Their role is specific to managing urinary incontinence, which is a separate issue. Patients with bladder cancer who also experience urinary incontinence may require different management strategies, and the decision to use mesh slings will depend on individual clinical circumstances. In summary, synthetic mesh in bladder sling surgery works by providing a supportive structure beneath the urethra. This helps restore continence by compressing the urethra during activities that increase abdominal pressure. The procedure is minimally invasive and effective for stress urinary incontinence, but it requires careful patient selection and monitoring for potential complications. Always consult a healthcare professional for personalized advice and treatment options.